So what really is kennel cough? We're going to look at symptoms, outcomes, we're going to look at prevention, and what we can do to assuage problems in our own pets. If you got a little dog, you want to get on top of the kennel cough immediately. We'll touch base with that as we get a little bit farther along. But little dogs are a completely different entity than big dogs when it comes to kennel cough. Because that's a little bitty windpipe. Big dog's got this big windpipe, much more easily damaged if you got a 10-pound Chihuahua or Pomeranian. So what this infection looks like, how is it spread? Is it contagious to people? Can cats get it? Right now at this stage, for sure, the mystery respiratory infection that's sweeping the country at the current time is not affecting the feline population. As we'll see as we get along in the episodes in the past, I've talked about this, but kennel cough is a multifactorial thing, scores of infections, some of which can infect cats. So the mostly coughing in cats is not that much coughing. They get upper respiratory and sneezing type things. There are vaccines for cats, but the current state of upper respiratory infection for the kitty cat right now is basically 0 to no risk. So you guys can be happy. Happy you got cats. So kennel cough is a highly contagious multifactorial disease that creates chronic or acute inflammation in the upper airways, that's the trachea and the bronchial tree. Multifactorial means that we've identified well over 30 individual pathogens that can cause this. The real problem is they're never just one at a time. They're 2 or 3 or more. And if there's 2 or 3 or more, 1 plus 2 doesn't equal 2 from the standpoint of bad. You end up with really bad morbidities and comorbidities, and we don't like that because they could lead to a bad outcome. So the disease spreads rapidly through upper respiratory contact, sometimes surface contacts of the infection, depending on which one it is on the surface and relatively fresh, but primarily upper respiratory in confined type areas. But I've had at least one patient in this last crisis that picked it up just wandering around the street, licking the grass. The dogs at highest risk are boarding kennels, daycare, rescue centers, dog shows, agility competitions, any congregation of dogs in any one place, dog parks, trials competition, even grooming parlors are not immune to it. Could you go to the veterinary hospital? Yes, but right now I'm certain that most veterinarians are taking huge precautions just like we are. So, symptoms: harsh, dry cough, retching and gagging. You kind of a type gag that comes up. Most of them aren't running a fever. If it is, it's relatively mild. It's relatively mild. Many of them will have a slight appetite drop, but it's in the mild cases of classic kennel cough, it's not that bad of a disease in the bigger dogs. In the littler dogs, you might have a problem. A few will have nasal discharge, runny nose, etc. If the symptoms progress, you can get appetite loss, you can get fever, nasal ocular discharge, and they feel bad. Why are they feeling bad? Because it's progressing more deeply from the upper respiratory tract into the lower respiratory tract. And these guys, at that point, are thinking about getting pneumonia, and that's the target of our treatment, is to prevent this illness from getting farther from just a mild bronchitis and a retching type cough. If they go into labored breathing, not good. Mitigating factors: age, poor health, vaccination status. Although we've got over 30 organisms that we talked about, a reasonable percentage, maybe 20%, the most common ones, are preventable or at least ameliorated by vaccinations. We have vaccinations for distemper, for influenza, for pneumonitis, etc. If today's episode has been a benefit to you, hit the like button so that other folks and their pups will benefit as well. Little dogs, we said, were a big problem. So we've got the spine right here. We've got the lungs right here. We have the heart right here. The windpipe, the bottom of the windpipe is this black line right here. You can see 2 little red arrows on your screen that highlight the top of the windpipe on the 2 arrows on the top, the bottom of the windpipe and 2 arrows on the bottom. And the takeaway from this is this windpipe is pinched. The patient can't breathe, and that's a big potential problem. So what may or may not be happening when this patient and this little dog is not breathing properly kind of looks a little bit like this. I think we better draw this, otherwise it's not going to come out very good. Where are we here? So the windpipe should be relatively homogeneous. On that radiograph, the heart was right here, and those arrows were kind of right about here. And what was happening was that this windpipe was kind of pinched, a little bit of a pinch right here. And that pinch represents a weakening or a collapsing of the trachea and the windpipe. And the reason why it pinches is that the velocity of the air going through this area of the windpipe causes a pressure drop. The pressure inside here drops and you get more pinching. The absolute condition is called collapsing trachea, and it's going to occur only in your tiny breed dogs, more than 25 pounds, not impossible, but extremely rare. And these 10-pound Pomeranians, Chihuahuas, whatsoever, if it starts pinching, it's going to stay compromised forever, and it will and can reduce your kids' quality of life for sure, but unfortunately, quantity and life expectancy are going to be compromised as well, and we want to prevent that. The main way to stop it is to stop the cough. These kids need to be on significant cough suppressants, because the more they cough, the more velocity that goes through that windpipe, the weaker the pressure drop sucks that windpipe down, makes it more mobile, and gives them more risk at developing a chronic and possibly permanent problem that will compromise their life, quality of life. And we don't want that. So what's really happening here is that we have what's really happening with this severe episode that's been plaguing our dogs throughout the last several months. We've discovered that the outcomes range in 3 groups: mild, chronic, and poor. The mild group has basically classic kennel cough, but it just seems to last forever, 6 to 8 weeks. They're not that sick, but they seem to cough forever. And I certainly have one of those patients in the practice that we're managing right now. They seem to be fine. They seem to be healthy. They're bouncing around the house. They still want to cough way past the normal cough cycle, which is basically 2.5 to 3.5 weeks. For classic kennel cough, the outcome number 2 is a severe pneumonia that's minimally or not responsive to antibiotics. These patients need to be hospitalized, and they can go from not too good to critical. And the third outcome is that acute pneumonia progresses rapidly. They become severely debilitated, and many times lead to a very poor outcome, i.e. death, in as little as 24 to 36 hours. They obviously are in the hospital and need intensive care. Statistically, over the last period of time, the emergency centers have reported and the referral centers have reported about a 50% increase in pneumonia cases. That doesn't mean 50% of the dogs are getting it. It means that the emergency centers are overrepresented with the really, really, really sick, and their case load basically blipped up. And that's the reason for this Mr. Respiratory infection making the news and all of this stuff. So my assessment for sure, what it's not known flu, it's not known bacteria, it's not known viruses, it's not known mycoplasma. How do I know that, and why do I say that? Because the majority of these dogs that are being treated and are being diagnosed and successfully treated are being tested by the standard of care testing that we have today, which we didn't have as little as 5 or 10 years ago. We have basically a forensic screen for 12 or 13 different pathogens, from bacteria to mycoplasma to influenza virus to pneumovirus to whatever virus you want to test them for, the bacterial cultures, etc. And none of them are consistently positive for anything. A few here, a few there. Most of them are sterile. They're not showing positive to anything. And so what does that mean? Well, it means that you have 2 choices. You have an emerging disease that's brand new, and it's going to sweep to the population and be devastating, and we're going to all be in trouble. And that was our fear and our concern, and I believe in the early stages, valid to be that concerned and to be very, very cautious. And I'm not saying we still shouldn't be cautious today, but I think that that scenario is just not valid. This is not a new emerging disease. And I can say that unequivocally because we saw a new emerging disease back in the late, I'll be within a decade or two, late 70s, early 80s. Parvovirus hit the canine population. And when parvovirus hit the canine population, it was horrible. The last couple months that we've been dealing with this mystery upper respiratory infection, it hasn't been horrible. Cases here, they come in, they're sick, they're treated, they get better. Maybe they last longer. Maybe they're sicker than anybody wanted to be, but they just didn't fall into the classification in this scenario of a new emerging disease. Look at the emerging disease that the human population just experienced back in 2020 when the COVID-19 hit the streets. Everybody was sick. The number of cases went like this and went absolutely phenomenal for months and months and months and over a year until things could get under control. That's what happened with parvovirus. When parvovirus hit, we had this horrible diarrhea that hit the susceptible population. And what was the susceptible population? Every breathing dog was susceptible. There was no vaccine ahead of time. There was no exposure ahead of time. It was a mutation in the gene pool of the parvovirus, kind of like the coronavirus that blew up in China. And it just swept through the population. People were walking around with the dogs in the air like footballs when they went outside. It was terrible. And that is not what the scenario is with this mystery respiratory infection. So I'm going to say that the mystery respiratory infection is very similar to just the human bad flu season. If you infect the population with kennel cough in any given year, you're going to have some patients that don't have any problems. You're going to have some patients that have the average problems that we've been talking about, and you're going to have a few outliers with a bad outcome. Bad outcome is code for death. Look at the human population right now. What happens with people flu? In people flu, you have the most at-risk population, which is youngsters and oldies, right? The 99-year grannies whose immune system is what? Pretty weak. You have the youngsters whose immune system isn't developed yet, and they're at a higher risk. That group is going to have bad outcomes over here, and you're going to have another group over here that has higher resistance and never have any problems, and then you're going to have the bell-shaped curve in between. All of us have been around long enough to know that there are bad flu seasons. If the program's been of benefit to you and your pup, hit the subscribe button below so that you won't miss any future episodes, and your pup will continue to benefit as well. Thanks. So what happens in a bad flu season? More people get sick, more people have these problems, maybe fewer people were vaccinated. Whatever factors there were, you have a bad flu season. That's exactly what I believe is happening with the canine population. When I was a puppy veterinarian in school, one of my mentors, Ed Donovan, told me that he said, Bauersfeld, every 7 to 10 years, a bad upper respiratory infection is going to go through the canine population. Do exactly what we trained you to do, and you're going to be just fine. Looking backwards, every 7 to 10 years, it's kind of like a bad kennel cough season. What we have going for us with kennel cough is that it seems to be related to people travel. Why is that? In the summer, people get out of school. We have summer vacation. Kids want to travel. You want to go to Disneyland. You want to go to Disney World. You want to go to the beach. You want to go to the mountains. You want to go Europe for vacation, Hawaii, whatever it is. What happens to Fido? Fido goes in the boarding kennel. What's a high-risk area? The boarding kennel. And so the kennels in the summer are up to the gills with dogs, and they get what? Kennel cough. And every decade or so, there's a bad flu season. There's a bad kennel cough season. Same thing with winter and winter travels when we had this whole big episode. Thanksgiving, people want to travel, go see their families. What happens to Fido? Fido goes in the kennel. Christmas right down the corner. We have all that going on. Now that we get past the first of the year, the weather's changing. People are back to work. Kids are back in school. Fido's sitting at home under the table, suffering from separation anxiety or whatsoever based upon our experiences with COVID. That's a whole nother chapter. But That's the deal. It's simply a bad doggy flu season with a lot of publicity. Flu is an asterisk. It's not doggy flu. It is not. It is not canine influenza. I don't think any of these dogs have been tested positive. Not, certainly none in Southern California. There's not a flu outbreak, but there is a kennel cough outbreak. It's a bad kennel cough season. Don't forget your copy of my Killer Cough cheat sheet. It's in the description below. Find the link and download it. It's yours, my gift to you and